Good morning, good evening, good afternoon to everyone that's joining us. We'll take a few minutes just to wait for others to join. But as usual, feel free to introduce yourself in the chat and tell us your institution and where you're joining us from. Feel free to also just send a note on what the highlight of the webinar series has been so far for you, if you have been consistently joining. And if you're joining us for the first time, feel free to also send a note on what you're looking forward to the most from this particular webinar. We will start shortly. Good morning, good evening, good afternoon, depending on where you're joining us. Super excited to be moderating this wonderful edition of our webinar series. If you have been joining us consistently, you know that this is the 13th webinar in our series, and super excited that this webinar is super packed. We have two presentations in one session today that are very interlinked. We would see a very innovative tool that helps utilities, municipalities, and institutions to think, to assess and understand how mature and robust their data systems are, to look at which linkages need a little bit more strengthening in a bid to develop hosted plans to strengthen data systems. We know that data systems are a big part of the work that we do within the sector, and we know that for us to be able to make the right decisions, we need to ensure that our data systems are consistently adapting to our realities, but beyond that is that they are effective and they have the right data to help us make those decisions. And then complementing this maturity assessment would be some key highlights and key lessons from the health sector. We know there's usually a tendency across various sectors to focus more on intra-sector learning, but the session today will look outside of the water and sanitation sector to draw some of the lessons from the health sector and draw some intersections with some of the health data systems. We know that while there may be some unique data systems cases within a specific sector, a lot of the gaps, challenges are very similar. And we have sectors that have walked the data system strengthening path longer than others. And so it's always nice to ride on some of those best practices that are transferable and adaptable across various sectors. And so again, super excited that this is a packed webinar that not only helps you have a hands-on tool to help you think about and identify potential areas of improvement, but also gives you very tangible, practical best practices that you could employ in your work. My name is 𝗪𝗲𝗪𝗁 𝗪𝗁𝗪𝗁 and I am an associate principal at Dev-Afrique, and I would be your host in this 13th webinar. Also, just important to note, as you can see on the screen, we are bringing this webinar to you in partnership with SOAS and 𝗪𝗲𝗃, who have been our partners and all-weather partners throughout the webinar series. Just a snippet of the WASH Data Labs, which is the anchoring institution for this webinar. We have been implementing a project for the last couple of years, about 2 years now, and the goal has been to improve public data systems for effective decision-making and performance management for sanitation service delivery. And our focus has been at the local level, which is the municipality and the utility. And even more specific, our work has focused on, one, improving understanding of data systems, strengthening best practices from different sectors. And that's why in today's webinar we would be spotlighting some of these best practices from the health sector. We have also focused a lot on understanding non-sewered sanitation data systems across sub-Saharan Africa, where we have landscaped the non-sewered sanitation data ecosystem in a bid to identify where the sector is now, what the opportunities are, and what some of those recommendations that we could put in place to ensure that we continue to run smoothly and effectively, especially given that non-sewered sanitation is a sanitation service that covers for the majority of sub-Saharan Africa. And then we've also supported the development and piloting of the maturity assessment, and this was developed by Athena, by Athena, obviously anchored by SOS, who are the owners of the maturity assessment. And SOS has done an amazing job, which you will see, in ensuring that this maturity assessment is adaptable and easy to use, and that it gives you very strong recommendations on how you could strengthen your own data systems. And then we've landscaped data and operation management systems, what others would call tools, across sub-Saharan Africa, with lessons from South Asia, given the fact that South Asia has some of the most robust and mature data systems. And so we have a repository on the WASH Data Labs website that is a one-stop shop for different actors to have a sense of what is out there, who's using what, and how is it being used to improve service delivery and performance management. And then the last component has been to provide technical support and facilitate cross-learning. And within this arm specifically, we have developed a non-sewered sanitation best terms of reference and specifications document that anyone within the ecosystem could leverage to build a non-sewered sanitation module within their already existing data systems, and also obviously facilitating a lot of cross-learning through different engagements, convenings, and this webinar that we have today. We initially started as a project, but later transitioned into a program just to ensure more sustainability and ensure that all outputs are anchored and sustained on a living platform. And that's why we now have the WASH Data Labs, which aims to basically co-create data system strengthening solutions, to champion data system strengthening best practices, and promote data systems knowledge exchange. Again, all of this stemming from a landscape assessment that we did, which showed some gaps, and the WASH Data Labs is trying to fill those gaps by ensuring that we are plugging in where there's the most value. And this is a snippet of some of the outputs that we have put out there, and these have been shared across the webinar series, and my colleagues would put links in the chat to the website, just so that for those that may have not seen these outputs, able to visit the website, read more on the non-sewered sanitation data systems landscape assessment, interact with the tools mapping dashboard, and feel free to also add tools that you may think are not included, but are very effective in driving work and performance management, service delivery improvement across the ecosystem. We also have the TOR that I mentioned that you could download, and we also have videos and video links to the webinar series for those that may have not attended our earlier sessions. Our webinar series was initially designed to ensure that there's a platform for actors and stakeholders within the water and sanitation space to prioritize and put data systems top of mind. And I mean, when we say data systems, we talk about it as an all-round phenomenon, not just the infrastructure or the technology, but everything around, how data is basically generated, analyzed, operationalized, and the various principles that guide how a well-functioning data system should run, ranging from governance, data access, data interoperability, to mention but a few. And we have partnered, as mentioned, with the Eastern and Southern Water Association, Water and Sanitation Regulators Association, ESOAS, and the Global Water Operators Partnership Alliance, 𝗪𝗪𝗋, across the series to ensure that we have the most impact and to ensure that we are getting a step closer to closing data gaps, addressing operational efficiencies that come with the use of anecdotes rather than evidence-informed practice, and promote sustainable data-driven sanitation solutions. We have reached to over 1,000 participants over the course of the series from over 40 countries, and spotlighted 12 tools, and some of them are down at the bottom where we have 𝗪𝗿 Water and 𝗏𝗏𝗄 𝗪𝗏𝗀 𝗪𝗏 WaterNet, 𝗪𝗏𝗃 Sunny Tracker, to mention but a few. And some of the highlights have been some of the webinars that have had like the most participants and participation. We have had the AIT Global Water and Sanitation Center, who have developed the IMIS, an open source platform with about 147 participants. And then 𝗪𝗪𝗪 in Tanzania, who presented 𝗪𝗪𝗪 with about 132 participants, and 𝗪𝗪𝗪𝗪 from Kenya. The most exciting part for me today is, to listen to the amazing presenters that we have, who have prepared amazing content around how do we basically assess how mature our data systems are, what are those important dimensions to look at, and how do we interact with this digital platform to basically help us generate the insights we need to be able to strengthen data systems, and then leaning on what are some of those very robust best practices from the health sector, given that the health sector has walked this journey for some time. What have they learned over time, and what are those very strong learning points that are transferable to the water and sanitation sector? And I'm hopeful that everyone will get as excited as I am and get a lot of insights on how we move forward with our data systems. Without further ado, I would like to introduce our presenter for the day. The first presenter for the day, 𝗪𝗪𝗪𝗀 𝗪𝗪𝗪 from ESOAS, who would run us through the data systems maturity assessment, from how you answer the questions and basically how it operates. And 𝗪𝗪𝗪𝗀 has experience and has been in the IT space for over 15 years within the water and sanitation sector, and has worked at various levels from regulation to service provision, and has a wide range of experience developing and implementing different systems for water and sanitation regulation and performance management. And so super excited and honored to have 𝗪𝗪𝗪𝗀. But just before 𝗪𝗪𝗪𝗪 comes to share his insights with us, I would like to remind you that through the course of the webinar, please ensure that you interact through the chat. Your microphones are muted, but when we get to the question and answer session, we would unmute all the microphones just to ensure that we have an interactive session. We encourage you to ask as many questions as possible because this webinar is only as good as the participants, because we do this to ensure that it's a co-creation platform for solutions rather than a top-down transfer of insights. So we want you to share your experience. We want you to ask questions on how some of these apply in the work that you're doing. And as mentioned today, because we have two presentations, we would break it down. After Joshua's presentation, we would have a Q&A, and then we would pause for about 5 minutes, and then we would move to the next presentation, and then we would also have a Q&A. With that said, I would like to welcome Joshua to the stage. Joshua, the floor is yours.
Thank you, Shuko. Good morning, good afternoon, good evening to all our participants who have managed to join today's webinar. My name is Joshua Quimonho. I support 𝗪𝗯𝗃 in its role of strengthening regulatory information systems across its member states and across the continent. 𝗪𝗯𝗃 mainly plays a catalytic role in strengthening regulations across Africa by helping governments and regulators build the systems and the skill set that they require to carry out their mandate for provision of safe, quality and reliable water services and also sanitation services. So at its core, 𝗪𝗯𝗃 brings regulatory experience and a continent-wide perspective so that countries can learn from each other as they adopt approaches and best practices that work in their context. To support this mission, 𝗪𝗯𝗃 has developed an assessment tool that is specifically aimed at helping countries and institutions understand how strong and effective their data systems are. The tool is designed for practical use by government ministries, municipalities, regulators, utilities, and development partners to diagnose, as Shuka have already highlighted, the strengths and weaknesses in their data systems and to point out to concrete areas where actions can be prioritized so that improvement can be realized in terms of using the systems to create a data-driven culture for decision-making in the water and sanitation sectors across Africa. So the tool provides a holistic assessment of the data systems in an organization in a given nation, and it uses two aspects: the qualitative and quantitative assessment aspect. For quantitative aspect, we are looking at objectives and metrics such as how data systems feed into given KPIs. And for qualitative, we are looking at internal data tools for data collection, systems and processes, and also data governance and how this can be improved to ensure that organizations and individuals can point out where bottlenecks lie and they're able to improve their data systems. When we look at the situation of data systems across Africa, we have many countries that still lack reliable decision-related data that is needed to carry out their mandates in terms of water and sanitation. As a continent, we are also supposed to report the progress towards SDG 6, and we are lacking as a continent in terms of quality data, reliable data that we can use. This map is showing tracking of the goal commitment by member countries, and you can clearly see some of the countries at different levels. Some are high, some are moderate, but even more was that some of the countries, information could not be accessed or there is no data on various aspects of the goal commitments. So as a practitioners or as people who are in the water and sanitation sector, we need to establish baselines for quality data, we need to identify priority areas where we can bring about interventions in terms of investing in data systems so that we're able to demonstrate as a continent that we are able to produce quality information, quality data that can be able to be used to track and report on our progress as a continent in terms of SDG 6. Without data, decision making on simple things also becomes difficult. Regulators and utilities are unable to make decisions on basic things like their day-to-day operations in terms of licensing, tariff reviews, and such. So this tool has come to bring about an assessment that can be able to bring out the issues that are affecting the data systems in terms of processes, governance, data use culture, and such. As we always say that we cannot manage what we are not able to measure. So this framework will give you a clear and actionable pathway for moving your data systems from messy data systems into trusted database systems that can be used to make database decisions. The idea is to start small and to deliver results into key areas that can be able to be scaled up into an organization-wide kind of improvement. And we are looking at improvement at an organization level that will inform improvements in the national level in terms of data systems. This tool is, the main goal of the tool is to close data gaps from the record level, that is from the utilities and service providers, who are the main primary data collectors or data generators for the water sector, up to the national level and basically feed into the global monitoring systems. So when all the levels are connected, we expect that data will become more accurate, more timely, and more useful. The Data Systems Maturity Tool provides a basis for determining critical interventions that you can carry out in terms of improving your data systems, and we ensure that we track the results of such interventions until we ensure that our systems are mature. Data, when you look at the part that is down there, we can see a maturity assessment framework that an organization can use with the various levels. Like we have M1, which basically shows that the data systems are just basic. There could be large gaps in terms of the quality of data, and there is very little validation of data and no integration. Then an organization can move to the second level, where the data systems start to evolve. You have now processes and systems starting to emerge. There's some level of automation of data collection, data use, and such. Then level 3, the system becomes mature, so there is consistent, and the systems become more reliable, and there is routine data use for decisions. In the last level, where now the data system have become more mature, they will become self-sustaining, and there will be an institutionalized kind of a process for continuous improvement and sustained financing of data systems. So at this level, an organization or a nation can start to document best practices that can be shared across different organizations and across different countries. So the main goal of the system is to close data gaps across these levels. And it is good to point out that a data system is not just about technology. It encompasses technology, processes, procedures, and human resources. So this Data Systems Maturity Assessment Framework will present you with a tool that can be able to measure various aspects in terms of technology, processes, procedures, and the human resources and the skill set that they have to learn and operate the data systems. The Data Systems Assessment Framework mainly assesses data systems in 3 levels. we have the ecosystem level. This maps the national enabling environment for data systems across the national level. And we're looking at policies, processes, and responsibilities in terms of data management, so that we see at a country level where systems are either enabling or blocking decisions-led data in the national level. Then we have the organizational level, where we assess the internal environment for data systems. So basically here we are looking at an individual regulator or a utility and the enabling environment internally. So we're looking at things like, do we have specific rules that deal with data management? Are there SOPs? Do the staff that are available in the organization, do they have the right skills? Does the organization engage in terms of training the staff and other people in terms of data? We're also looking at how data is governed, data governance in the organization. So basically, it's to ensure that we convert the national interventions and national priorities into organizational activities that can bring about changes that can affect the organization and thereby improving systems up to the national level. At the data systems map, we are looking at showing how effective internal systems are, what type of tools are used to collect data, are they automated, are they paper-based. We also look at how integration is in terms of internal systems, such that we have one department integrated with another department in terms of data sharing or data use. And we also look at how decisions in terms of data map into specific KPIs that an organization tracks or they are required to report on. So basically, we use that assessment to make technical fixes and increase integrations across departments in terms of data systems, so that we can reduce manual entry of data and we can ensure that data, as it moves across the organization and also across the national level into the global level, we reduce data errors and we also we increase the value of that data. So in terms of organizational level, if you connect slide. In terms of the assessments, the first part of the tool, the ecosystem tool, as I have said, we are looking at the national level. So we are looking basically at the national enabling environment for data systems. So we are looking at the policies, processes, and responsibilities, so that we can see as a country where our systems are they blocking or enabling decisions in terms of water and sanitation decisions that we need to do. So we usually use a series of questions where the user is able, or the person doing the assessment is able to pick yes or partially or no, and you are going to assess various aspects such as national guidelines on data, whether the country has standardized tools to collect data, how data is governed in terms of coordination, data management and such. We also look at whether there is a coordination mechanism across the data collection points, and we also assess who is responsible for reporting on what KPIs across the sector areas. These sector areas are the urban water and sanitation and also rural water and sanitation. We also look at other areas such as how financing is done for data systems. We look at regulation of the data systems, and we also look at the utility operation in terms of generation of data for the sector. So the results will show what is down there on the slide. So you have a map showing, or a heat map showing various color-coded sections that have scores. So where you see green, it means that that aspect is very strong in terms of data system. Where you see yellow, it shows that there are some gaps. Where they are red, it shows that there are major gaps. So as an organization or as a regulator, these are the areas that you need to put more emphasis on so that you are able to eliminate the major gaps as you move to the partial gaps until you have everything as green to show that your systems are becoming more mature. So this is also linked into a dashboard that will show you the current score, an indicative score of where your data systems are. So the main focus is to move from technical fixes into fixing the policy, the coordination mechanism for both the resource allocation and also how data is managed. So instead of learning to only cure the technical fixes at the organizational level, we also need to fix the policies and also the coordination mechanisms. So at the organizational level, this is where we assess the internal organizational enabling environment. So basically, a regulator or an utility or an agency or a municipality can be able to carry out these assessments. So the goal is to turn the national expectations into reliable day-to-day data practices that you can be able to use to ensure that the data systems that you have at the organization level are able to give decision-ready data that can feed KPIs that are required at the national level. So in this aspect, we look at areas across the data value pipeline, that is data collection, data ownership, data openness and flow, how data flows across teams, external actors, and also across internal actors. We look at data quality, so how data is cleaned, validated, and audits. We also look at how data is used in terms of informing specific KPIs, informing operations of the organization, and also most importantly, informing how resources are allocated to both data systems and other aspects. So in this, also you get the same heat map. The result is you also get a heat map that has a score. So like this score is a score of 38. So this 38 basically summarizes maturity across those sections that I have highlighted, the data collection, data ownership, and such. So the red, as we have already said, means there are some major gaps that are present in this organization. So it could be such things like missing SOPs, there's no ownership of data in the organization, data is not validated and such. Yellow means there are some level of maturity, but you need to create some targeted interventions so that you can be able to improve the maturity of your data system. Such things like integrating systems, clarifying who owes what and what each department plays in terms of data collection, data management, and such. Green means that you are doing something good, so you need to document such practices and you use it to terms of sharing across departments or even across organizations. So the idea is to ensure that an organization reduces duplication of effort from data collection and also data use. So we are trying to ensure that an organization has credible data that regulators and government ministries or other actors outside the organization can use to make decisions. So the idea is to ensure that the day-to-day practices that an organization carries out are able to be broken down and we get fixes that we can be able to conduct as an organization so that our data becomes more useful and not just data for reporting. Next, Shupu. So on the third level of assessment, as I had highlighted, we assess the mapping of data systems. So in this one, we are looking at a diagram that shows in terms of departments, how existing tools and data systems collect data and how data flows from one tool to another, from one department to another. and how the data that is collected in an organization feeds into core KPIs. When you look at most of our organizations, there are many tools and many data systems that do not necessarily feed into any KPIs. Remember, the KPIs are what we are looking at, because this is where decisions, or these are the indicators that will help us to make decisions. So we map the systems that exist, we see how they are connected to each other, and more importantly, we also assess how effective those systems are in terms of supplying data that is needed for decision making. So the goal is to ensure that we provide a view of how linkages are, so that as you fix the systems in terms of the technical systems, as you maybe invest in more tools, you can be able to see how that tool is coming to connect with other tools that are existing. So the idea is to ensure that if there is a tool that you can be able to fix and it fixes several issues, instead of acquiring a new tool, you're able to do that. When you look at data systems across the sector, there are many organizations that are claiming to use ERPs, but instead of having an integrated tool, they usually have many tools with a single login, or many systems with a single login. So when you assess your data systems using this data system map, you'll be able to see how an ERP or a tool that is purporting to be an ERP actually is interconnected, and how data flows across departments, so that you're able to bring about duplications, you bring about the gaps, and you bring about where data is not connected from where it is collected, when it is analyzed, and how it feeds into KPIs. Next slide. So the data system map basically shows you where data is stuck. So the idea is to fix the entire pipeline, not just the tab. So buying a new system without fixing the pipe is just buying an extra tab that is expecting to get water from a pipe that has not been fixed. So if the pipe has a gap, no matter how many more taps you install or add, you still get the same thing. So the data systems map will try to show you where the pipeline is, so that you fix the pipe, not just adding more taps. So in terms of areas of assessment, we assess data systems across all the sectors that are there in the water and sanitation aspect. So the urban water supply, urban sanitation, rural water supply, in terms of coverage and such. We also track investments. We also look at regulations in terms of decisions that are required for regulatory aspects. And we also look at utility operations, because this is where data is coming from. So the idea is to ensure that we can fix data systems, the gaps that are existing across these sectors. If you can have fewer systems that are able to get data from all these aspects and feed into the required KPIs, the better. More systems means more problems, more integration issues, but less systems will help us to ensure that the data that is required is properly governed, improving the quality of the data. So in terms of data assessment, we also run through the data pipeline, data value pipeline. So in terms of how data is collected, we look at the instruments or the tools that you are using to collect data, how data how frequent data is reported. Is it monthly? Is it a daily activity? Is it an annual activity? Or it is periodic, etc. And how also completeness of that data collection exercise. Because if you don't have complete data, you go all the way to KPI, then you realize that there are some aspects that are missing, and you have to repeat the entire cycle. In terms of ownership, we look at who is responsible for collecting what data, who is responsible for storing what data, and how that data moves across the data pipeline and across sectors, and whether data is required to be manipulated further in terms of adding metadata and such for other systems to be able to use. We also look at how openness of data and how data is flowing. So how data is moved between departments, between organizations, up to the national level and up to the global level. We also look at how data is shared across organizations. And this is one of the key aspects that is missing in most of the data systems. Instead of having a system that is able to share data in an organization up to the national level, you meet a situation whereby the same tool is duplicated across the national level, the local level. So you have a lot of duplications. Then you have a lot of gaps in terms of developing the KPIs. We also look at the integrations of systems. For data quality, of course, we're looking at how data is validated, whether we have confidence in the data that is coming out of the data systems. And of course, on the data use, we want to establish a culture for data management and data use for decision making, as Shuko had highlighted, which is very key for any sector and organization, particularly as we track key KPIs like the SDG 6 KPIs. So we want, as I have said, we want to fix the weakest links in the pipeline, not just the tools. And we also need to ensure that the data that we collect and validate and store is feeding into multiple sector KPIs. And our ideal situation is having one system that can feed into multiple KPIs. So the idea is to ensure that we assign data ownership, we fix the flows of data, to ensure that data is quality, and that this data not only turns into credible data, but we're also using it to make decisions. Donors are using it to help to bring investments into the sector, and we also help to now help to report at the global level in terms of the global reporting requirements that we have as an organization, as a country, and also as a continent. We can move on, Shuko. So these are some of the KPIs that we track, and the tool allows you to add more KPIs that are customized to your organization or to your reporting requirements as an organization, as a country. So we're able to track all these KPIs and much more. Next. So in terms of ecosystem, as we have already said, a strong national enabling environment is the foundation of mature systems at the organizational level. So on this one hand, we want to ensure that we have a strong enabling environment in terms of policies, regulations, policies, standards, and also we have the right technology so that we can be able to support the ecosystem functionalities. That is the data collection, data ownership, data openness, and data quality. So you fix the environment both at the national level and at the local level to support the day-to-day activities in terms of data collection. So if you are able to fix the policies, if you are able to fix the people, and then you are able to fix this technology, you are able to have a strong environment that will actually turn your data into a more impactful kind of data that is more useful. So instead of just fixing the technology, where many organizations are currently doing for any issue with a system, the first thing they do is to buy a new system or to develop a new system instead of doing an assessment to actually bring out the issues that are making the system not to be effective to the function or to the objective that it was acquired for. And continue. So in terms of ecosystem, these are basically the ecosystem side, the issues that we usually track. We are tracking data collection. So in terms of data collection, we are looking at the tools and instruments that you use to do data collection. Then we're also looking at national guidelines. Are there national guidelines that guide how data is collected? Do you do inclusive data collection, or if you are like a regulator, are you collecting data from both the rural and urban utilities, or you are having only data for one aspect? Are you collecting data for water and sanitation together, etc.? We also have data ownership and management. So who owns what data, and how stakeholders combine or collaborate in terms of data, and how data is protected as it moves from one level to the other. More importantly, we also assess how data is stored and the security of that data to ensure that integrity of the data is maintained across the many levels that data is going to move from the local to the national level to the global level. In terms of data openness, we are looking at how data is shared across the departments, across organizations. So we're looking at do you have data sharing protocols? Are there procedures to share the data? And I do have policies that guide on how data is supposed to be shared, and what are the forms that you are required to share that data into, so that we encourage organizations to share data across, so that you don't have to have duplication of the same data. Now, when you aggregate the data, maybe at the national level, you have two sets of data, and you are unable to use that data for decision making. Next. In terms of data quality, we are assessing how data is, we ensure the quality of the data. So when we collect the data, do you have procedures and processes that track quality of data as the data moves in terms of data collection, data processing, up to the data use level, and also across the departments, organizations, and also across the nation up to the global level. So in terms of data use, which is also very key, we are referring to how data is used now to generate decisions, to generate insights. So we are looking at, do you have data systems that are able to do visualization and analysis of data, so that you can bring out the value in the data that you have collected? More importantly, is the data that you are collecting feeding into any KPIs or any reporting requirements that you have? You're also looking at capacity in terms of skills, and I ask you, as an organization, are you continuously training and equipping the data users and data collectors in your organization, which is also very key, so that you bring about a data use culture in the organization, and people start associating data with the growth and the responsibilities across the organization. Remember, how data is collected, used, depends on how individuals or organizations attach value to that data. So we need to keep on creating awareness for the value of data, or the data that we collect in the organization. So this is the tool. So you, as an individual or as an organization, you usually get an invite. The invite will create for you access to the system. And once you get access to the system, you are now able to do assessment across the three levels that we have discussed already. So ideally you should start at the ecosystem level, where you look at the national enabling environment. You assess all the aspects that we have discussed already in terms of national guidelines, national processes, national standards, in terms of data systems. Then from there, a regulator, like a national regulator, is the one that would be maybe be best placed to carry out assessment at the ecosystem level, that is at the national level. Then you transit now to the organizational level. So organizational level is whereby now a regulator will carry out assessment of the internal systems that they have, or a utility or a municipality can now carry out assessment of the data systems. that they have at the local level. Then from there, you are able to feed the data into the system map module, whereby now you're able to map your systems. You're able to see your systems in terms of departments, which tools you have to collect data, and how those systems interlink with each other. So the idea is to fix, instead of just fixing the technical aspects of data systems, we fix the processes, we fix the policies, we fix the standards, we fix the ownership, we fix the validation, that is data quality, so that as we map our systems, we're able to bring out the issues that we need to work on, instead of just having guesswork of fixes and improvements, and at the end we keep on buying or developing more and more tools that really do not feed into any aspects that are required at the organizational level, in terms of KPIs at the national level, and at the global level. So we have already discussed this in terms of the results that you get when you do assessment at the ecosystem level. So as we have said, there is a series of questions that you fill, and they are straightforward. And the answers that you give, the tool will be able to highlight for you where the gaps are. So we say that where you see the red shows there are major gaps, and these are the things that you need to fix first. They have more of a quick wins in terms of moving your system from one level of maturity to the next. Then you get scores that will tell you in terms of maturity level where you are. So the scores are important so that you're able to track progress, so that after you fix several aspects, you can carry out the assessment afresh, and you see whether the score has improved or not. So the score will guide you in terms of the progress that you are making, in terms of fixing the major gaps, in terms of fixing the use of data systems, and in terms of fixing the policies and procedures that are there that will feed into your data systems. So the whole idea is to ensure that we do not just fix technology, because if you fix the technology, the other issues that are supposed to be there in terms of providing an environment for maturity of the data systems will still remain stuck to where it was. So it's good to carry out the assessment, so that as you fix the technology, you also fix in all the other aspects, and you will be able to get as much value as you can from the tools you have. So in terms of the assessment at the organizational level, here we say that you are going to carry out assessment across the various sectors, that is the urban, rural, water and sanitation cover sectors. Then you have finances, and also in terms of regulating the data aspects of, or data systems aspects. So you have various questions. For instance, how poorly defined and consistently used parsing fragmented data practices. So you pick the level that is relevant to your organization. Then the tool is able to interrogate those aspects and will create a score for you. So areas that are not applicable for your organization, maybe you are an urban water supply utility, you don't have rural, so you can leave out those aspects. Then the tool will be able to only show you assessment for the areas or the aspects that you have as an organization. So as I have already said, you get a score, and the score is very important for you to be able to track aspects. And for each aspect of the data value pipeline, you'll be able to get in terms of the data systems that you are using for a given sector, like the urban water supply coverage. In terms of data collection, you are at what level? Maybe 50%. You are at 80% in terms of data quality, etc. So the red part is where the gaps are. These are the places that you need to fix quickly. Of course, when you have very low score, as an organization, you start with that, And the idea is that you may be able to fix, like now maybe you fix the data openness and flow, and you're able to fix a number of other issues that the tool has highlighted. So you'll be able to see your weak areas, then you'll be able to see the areas for priority. And also maybe as a donor, as a regulator, you're able to see where you can create, you can direct resources that can bring quick interventions that can bring value. So the idea is not to allocate more and more money or more resources to buy in more and more systems, to develop in more and more systems. The idea is to targeted interventions that can now bring about more value, and we're able to move maturity of data systems. And as we keep on saying, the idea is to have data that can be used for decision making, both at the organizational level, the local level, and at the international level. Shuko, we can continue. So in terms of creating a data systems map, you go through a series of interfaces whereby you are able to collect information that will help you create a data system map. So here you input data systems in terms of departments that you have. The idea is to input for all the departments that you have, the systems that you have, so that you are able to see. You can have many departments using similar systems that can be combined into one. Then the data is shared by those departments. For instance, we usually have finance systems that already have, for instance, like a payroll module. So you don't have to buy a new payroll module for your HR department. So you can have, instead of buying a new payroll module, you can integrate a data collection tool that will be able to collect the data for HR purposes and feed into an already existing finance system. Then the two departments can share the data. So that's the whole idea, to ensure that you can be able to see, in terms of tools, how well can you optimize the use, and how well can you be able to encourage sharing of data across departments and across various sectors, so that you're able to have more effective tools. So the next, you feed data, how data is used into by the system. So basically here you are just feeding data that will help you map your data systems in terms of linkages and such. We can continue, Shuko. So here is where I was pointing out you can do data collection, assessment, how data is, which tools you are using. Are they paper-based? Are they automated? Are they electronic? And how effective are those data collection tools? So we already know that if in terms of sharing data, would want to move to more automated tools than using paper-based tools. Most of the utilities in the continent and also across the globe have moved right now basic aspects like meter reading from manual meter reading systems into automated tools. And these tools, as we have already seen, you are able to feed data directly into the billing system, and you minimize errors and such. So here you now map how data flows between where it is collected from the tool that collects the data, and how data now flows from one department to another department. So you are still building on the interlinkages among systems, so that when you generate the data system map, you're able to clearly see how data flows from the department level to the data collection tool to other departments. So here you map the KPIs that are that you track as an organization or at the national level, or all the aspects that you are required to report and the required data. So we need to ensure that the systems that we have as an organization are actually helping us to make decisions by feeding data into specific KPIs. We don't want to acquire a system that just does data collection and data storage, but Beyond that, the data is not shared, the data is not used, the data is not informing any KPI or any reporting requirement we have as an organization or as a nation or as a continent. So we need to ensure that the tools we have are mapping into specific KPIs. So here you map for each system, which KPIs does it inform. So you can have one KPI for one system or one system mapping into different KPIs. And we said that the tool has specific KPIs already input, but you're able to add more and more KPIs based on the requirements that you have as an organization. Here you assess how fit for purpose the data systems that you have. So basically here is your own, in terms of your own evaluation, in terms of your own opinion, how effective or how fit that system that you are having as a department is to the purpose that it was brought for. So if it is HR, you have a payroll module. Does it function the way you expect it to work? Does it give you the reports, or does it bring out the information that you require for your day-to-day operations as a department? So after you fix this one, now you're able to generate a map that will clearly show you this system is not effective, this system is not as effective. So if you are maybe a donor or a regulator that is looking at funding the improvement of data systems, maybe in a utility, this is why it will be very key for you to look at, so that you are able to bring about resources that will be very targeted and will be really coming to create interventions that will add value to the organization. So at this juncture, I will do a small demo just to show you how data systems are mapped and what value you get from the tool. I will not be able to demo the entire tool since the tool requires a lot of data entry. So I will invite you, after we are done with the webinar, you can visit the website 𝗪𝗏𝗪𝗀𝗪𝗏.𝗪𝗏𝗪𝗏.org, and you'll be able to see how you can be able to interact with the tool. There is a user guide that will show you clearly, show you the steps that you require to go through until you create your own data assessment maturity map that will guide you now in carrying out targeted interventions that you can actually take as an organization, as a regulator, so that you're able to move your data systems from one assessment level to another. So I will show a data system map that has already been generated. So at the bottom, we're able to see various departments, and we're able to see the tools that they use for various activities. I wanted to show this one. So in terms of like now procurement department of this organization, you can see for data collection, they are using paper-based purchase requisitions, and the systems that they use is a Sunflow. And you can see at the top here, the system does not feed to any KPI. So this tool, as I had demonstrated, or as I have presented, will help you to see now the linkages. So you can see the Sunflow system does not help the procurement department to output any information that can feed to any KPI that the organization requires. When you look at another department like engineering, you can clearly see how their data systems that are used in that department are able to map into KPIs at the organizational level. So you can see here they use GPS tools. They have maps for networks, or maybe it is a mix of paper-based and automated tools. And the tools that they feed into ArcGIS and QGIS. And output from this system is able to feed into specific KPIs in terms of access, tracking of access, both for water and sanitation. So in terms of human resource, you can clearly see they use Excel to collect data. And they collect data from also maybe employee files. And the tool that is being used here is Sage. And it feeds into staff costs. So in terms of effectiveness, where you have the red part, it shows that the system is not effective. Where you have a yellow, it shows that the system is moderately effective. So for instance, this QGIS, you can see it is coded green. So that means that this particular system is very effective for the function or for the purpose that the organization acquired the system for. So the idea is to ensure that where you have less effective tools, either you fix the data collection part, or you fix the interlinkages between department and another, or you fix data ownership, you fix the procedures, you fix the policies, so that you turn them from being less effective to more effective tools. So you're able to map all the departments you have up to the KPIs that are able to be fed from data collection tools. So you look at finance, you can see finance also have some tools. If you look at procurement, maybe this Sunflow system is part of a module that is in the Sun system module. So you don't really need to have this module when you already have other finance, another system that is doing exactly the same thing in terms of getting procurement information. So you can improve this part here to ensure that you fix this system. So that's the whole idea about creating the assessment, so that you're able to bring out those gaps and you're able to have specific interventions that can bring about more targeted interventions that will improve your data system from one level of maturity to the other. And with that, I thank you all for listening to me, and I invite you, as I had said, you visit the Data Systems Maturity Assessment website, and if you have any support you would require, you can always write to SOS, and we will be able to support you to understand the tool more, and also to carry out individual assessments of the data systems maturity as we look at improving our data systems as a nation, as a continent, so that we are able to get proper data that can feed into the global arena. Thank you. Over to you, Shuko.
Thank you, Joshua, for that elaborate and exciting presentation. I'm seeing a lot of activity in the chat as well, with a lot of questions coming up, and so I'm super excited about that interactive session. But kudos to the amazing work that has gone into putting together this maturity assessment. I see it as a very valuable resource for the ecosystem, and I see it also, adapted to other contexts and other sectors as well, given how robust it is. Thank you, Joshua, once again. And I would like to note that there's a slight change. So we would take a short 5-minute break now, and then we would have a presentation on the best practices, and then the Q&A, just so that we have the Q&A all together. So keep your questions coming, and for those that may forget, please note them somewhere or just drop them in the chat, and we would be taking those questions. So we would be taking a short 5-minute break, and then once we get back, we would be getting into the next presentation, and then getting into the Q&A. Thank you, everyone. Please use this time to grab some coffee, stretch, as we come back shortly. Welcome back, everyone. I hope we took some time to stretch and grab a coffee or grab a water. We would reconvene to the next segment. The first part of the webinar focused on the data maturity assessment presented by Joshua from SOS, which is an assessment tool that is going to help utility municipalities to identify how mature their the data systems are, identify the gaps, and enable the development of costed improvement plans. We would move on to the next section, where we have Abigail Gilmer to take us to the next presentation around how what data systems strengthening best practices can be drawn from the health sector, and this complements very well what Joshua was presenting, and I'm pretty sure there may be some overlaps, right, given that there are the maturity assessment rides on data system strengthening principles. Abby Gilmer is a global health professional with experience in health system strengthening, monitoring, evaluation, and disease surveillance. And her experience includes research, evaluating public health interventions, conducting epidemiological analysis, and has worked for various institutions, including the WHO, the World Health Organization's Geospatial Information Systems Center for Health. And joining Abby is Michelle Schmitz, who's a senior consultant at Dev Global as well. Michelle is a trained infectious disease and spatial field epidemiologist, and has turned into a data scientist and technical consultant over time, and is very passionate about helping a variety of clients to understand and solve a broad range of global health, infectious disease, health informatics, and geospatial problems. And through all the work that she does, she ensures that all solutions are data driven. And I would hand it over to Abigail and Michelle to take us through the next section of the presentation. And as mentioned earlier, immediately after this, we would have a Q&A. So keep those questions coming in the chat, and we would activate the microphones after this session. Over.
Okay, thank you, Shugo. Hi, everyone, and welcome to the next portion of the webinar. We're excited to share insights from our latest research and discuss best practices from the health sector. Next slide, please. So the purpose of our presentation is to look at what comes after we identify gaps in WASH data systems like we just saw. We'll share lessons learned from health sector practices that can strengthen WASH monitoring and decision-making. We'll hope to inspire collaboration between health and WASH stakeholders. And we also want to catalyze action and encourage the adoption of health-informed, practical, and cost-effective approaches. So our next slide, Shuko. Our newly launched report aims to show the value of health data for WASH. For example, how health behavior and outcome data can guide WASH data system strengthening. It also aims to emphasize collaboration between the health and WASH sectors, to stress cost effectiveness by leveraging routinely collected health data to minimize the need for new infrastructure, and finally to provide actionable recommendations for practitioners, governments, and development partners to implement integrated approaches. So this report is now available on the WASH Data Labs website for you all to check out. Next slide, please. We're also working on another report that will be a sort of supplementary report to the first and will be published soon, so keep an eye out for that. but it's designed to be a practical resource that focuses on more of the local level data system strengthening. It distills the best practices from the health sector into a sort of playbook for WASH professionals. It offers more step-by-step guidance and examples of solutions that have already been tested. So why are we even looking at the health sector for WASH data solutions? Health data quantifies the burden of poor WASH with metrics like morbidity and mortality. Health systems already collect WASH-relevant data, such as hygiene practices and disease incidents. Health-based surveillance systems strengthen WASH planning by linking disease trends with WASH access to target high-risk areas. Health data also reveals hidden economic benefits by showing how these improvements reduce healthcare costs and boost productivity. And health sector partnerships enable sustainable impact through things like integrated monitoring and long-term improvements. We're also focusing on the health sector because it's surprisingly similar to WASH. Both have layered systems for collecting and reporting data, so solutions in one sector can often work in another. The health sector shift from paper to digital records is a journey that we'll discuss later in a few slides, and WASH is also on this, so there's a lot that we can learn about how health has made these changes. And finally, both sectors have shared a lot of the same challenges. So this slide shows a very simplified version of how data flows in the health and WASH sectors and how they compare. It's simplified, but it helps us see the parallels in health. And health and WASH. So data moves through clear levels up to ministries supported by strong systems, and the health sector offers a useful example of structured data flow. So this comparison can spark ideas for making WASH data systems stronger and also more connected. I'll pass to Michelle to continue with our journey.
Thank you, Abby. Okay. So generally, the health sector has driven to move from manual paper-based record keeping to integrated digital platforms, as you can see. But for a lot of these moves to happen, there have to be a lot of intermediate steps that can occur, some of which you see on the screen, such as an introduction of standardized data collection and reporting, investment in digital infrastructure and workforce training, adoption of electronic health information systems, implementation of routine data audits, and improved data quality, accessibility, and timeliness. However, something important to note is that many of these steps do not necessarily have to happen in this sequence. Many steps can happen in parallel at the same time. But together, adoption of these more digital platforms in conjunction with good record-keeping practices can improve the quality and the speed of data record keeping, making it easier to monitor health trends, target interventions and resource, and improve health outcomes. So the health sector has started with many of the same problems that WASH faces today, such as fragmented and siloed data systems, poor interoperability, and insight that weren't being used. However, there has been real progress that has been made, such as introducing structured surveillance and data collection systems, investing in digital transformation and implementing interoperability standards, and embedding data use into routine decision-making. So systems such as health information systems, or HIS, civil registration and vital statistics, called CVRS, and population-based surveys used in the health sector, such as the demographic and health surveys and the multiple indicator cluster surveys, or MICS, enable disease tracking, performance monitoring, and targeted interventions. While local facilities often have baseline mapping and routine data collection than WASH, thanks to clearer mandates, dedicated staff, and standardized indicators, there are particular challenges that the health sector faces that do not apply to the WASH sector. Some of these include the collection of individual patient-level data that have additional privacy guidelines that have to be addressed. And additionally, in many contexts, unlike what you just saw with Joshua's presentation, administrators cannot see the underlying processes or ERPs used to collect the data. However, there are still valuable lessons that can be applied to WASH, especially in how to structure governance, build interoperability, and make data part of everyday decision-making. Next slide, please. So with that, I'm going to go into some health sector best practices. Firstly, on health facilities, governance is not just a policy, it's operationalized. So staff know exactly who's responsible for data entry, validation, and reporting. And these processes are monitored through supervisory visits and audits. So this clarity ensures consistent and reliable data flows. We know that fragmented responsibilities lead to gaps and duplication. But as you can tell, utilities need formalized mandates and local accountability systems, so reporting can become more routine and enforceable. In health facilities, data quality is directly embedded in data operations. Within both paper and digital systems in the health sectors, records are routinely cross-checked against patient registers and other sources of data through the process of triangulation. Inconsistencies are flagged by automated systems, and staff receive training on error correction. That said, many different health sectors collect different indicators, but there are a broad set of guidelines that can be implemented for individual data sets and use cases from global and national sources. All of these steps together can ensure that decisions are based on accurate information, while not conducting any of these processes results in more unreliable service data. If we're taking some of these lessons into the WASH sector, introducing systematic validation and feedback loops at the utility level can make data more credible for planning and investment. So health facilities cannot work in isolation. Ideally, they have to feed data into national systems in real time, which enables quick responses and resource allocation. Integration of this data is critical for efficiency, as relying heavily on manual spreadsheets and paper records can slow decision-making and limit visibility. I mentioned here some platforms such as a digital health management information system that can be utilized at the local level that can feed up into national levels for instant updates in near real time, depending on how it is implemented. But I also mentioned here that specific to electronic records, there's the use of system-to-system messaging standards, which are known as HL7 in the legacy system and FHIR in the more modern system, along with a set of standardized vocabulary that allows for interoperability between electronic health records, laboratory records, or ELR, and medical records, known as EMR. Transitioning to interoperable data platforms, taking these lessons into account, with some set messaging standards and indicators and data integration will allow utilities to share service data quickly, improve planning, and demonstrate performance to regulators and funders. So effective health facilities don't necessarily rely on short-term projects or short-term implementations. They do budget for data systems and data staff as part of their core operations. In addition, many health data systems, such as DHIS2, are free to use by LMIC stakeholders. This can lead to locally owned solutions. So some of these actions can ensure sustainability and continuity. So to build resilience, utilities should allocate resources for data systems in their own budgets and advocate for municipal and national support. Demonstrating a return to investment over a set period of time and accounting for better planning and fewer service disruptions can strengthen your use cases. Sorry, one moment. In health facilities, data is not collected as well as often actually used. This leads to a culture of data-driven decision-making. So, for example, at the facility level, dashboards can collate data and show performance indicators, and these can help to guide decisions and improve patient care. Additionally, even higher up, even looking outside of our smaller utility level or outside of the health facility level, collating lower level data at higher administrative levels can lead to strategic programmatic decisions and evidence for action. So this creates a culture where data drives decisions. So what this means for WASH is that creating standardized dashboards and feedback systems so managers can use data to plan repairs, monitor service quality, and respond to issues quickly is most relevant. And in terms of continuous capacity building, in health facilities, we all know that capacity building has to go beyond data entry. So we know that staff are trained to interpret trends, identify gaps, and adjust operations, whether it's in staffing, stock levels, or patient flow. Facility staff often receive ongoing training to interpret this data and apply it for resource allocation and service improvement. This makes data actionable and actually usable to make decisions quickly and in real time. However, stopping at collection leads a gap in analytical skills. Structured programs for implementation and planning enables managers to use data for preventative maintenance, resource optimization, and service reliability. So, for example, training utility teams not just to collect data, but to analyze trends and use insights for operational decision-making is most relevant here. And I just want to call out that there are examples such as in measure evaluation in the health sector that contains a lot of resources for how to collect data and have data-driven decision-making and data-related capacity building. Next slide, and I'll pass it back to Abby. Thank you.
Okay, so drawing from these best practices, we'll now look at some of the recommendations that our research has resulted in. First, it's to prioritize policy reforms and institutional arrangements so roles and responsibilities are clear. Invest in workforce capacity and digital tools to move beyond manual reporting. Leverage existing health and administrative data systems for integrated planning. Strengthen accountability mechanisms through things like audits and reporting requirements. Define governance and institutional mandates to eliminate fragmentation and other issues. And finally, to ensure sustainability by embedding data systems in budgets and promoting local ownership so there's less dependency on short-term donor projects. So to continue with these recommendations, but being a bit more specific by stakeholder type, data system managers should focus on strengthening interoperability so utility data connects with municipal and national platforms. Initiate cross-sector data reviews with health and also other sectors to identify service gaps. Incorporate health outcomes into monitoring and evaluation frameworks to show impact and justify investment. And build capacity for using health-related data in operational decisions, not just collecting the data. For governments and their partners, the focus should be to develop national frameworks that set standards for governance and interoperability, pilot integrate surveillance systems for early warning, and invest in real-time data platforms to improve responsiveness and planning. Okay, so thank you for joining us today. Our first report is now live on the WASH data website, so please take a look and read the full report. And then also stay tuned for the supplementary report that's coming soon on best practices from the health sector. Now we'll take a few minutes for questions.
Thank you, Abby and Abigail and Michelle for the amazing presentation. A lot of points that hit home, and I think one key takeaway for me is ensuring that data is not just collected, but embedded into operations management and efficiency in a bid to improve performance management and service delivery. I think that's a very exciting lesson coming from the health sector. And combining the two presentations from Joshua, where we see how to identify gaps, and riding on lessons from the health sector on how we could strengthen our data systems and go on to design those costed operation and efficiency plans. I think this is a very well weaved trend and message that has been sent. And having said that, I know there's a lot of questions, and the participants are aching to ask and have their questions answered. So without further ado, I know the microphones would be activated shortly. But there are questions that were already in the chat. And so once the microphone is activated, please feel free to raise your hand and we would have you ask your question and share your own experience, share reflections. But as we are waiting for that to happen, there were some questions in the chat that I would bring about. The first question was from Ishaka Sharif, who asked whether the data maturity assessment platform has the ability to have an account created so that the participants can get a better understanding of the system. So this one is for Joshua. Are the participants able to create accounts within the maturity assessment platform in order for them to test and appreciate its functionality? And then Ishaka also had another question around, can the maturity assessment system be integrated with other data collection tools for the purpose of data submission? And then I would, read 3 questions and then allow you to answer those. And then Andrew Masie also had a question. Is it possible members to use the DSMAT? So those are the 3 questions. And I would pause and pass it to you, Joshua.
Thank you, Shuko. And thank you for those questions that have come in. I'll combine the last question on if members are able to use DSMAT and how can one access the tool. So if you want to use the tool, you write to 𝗪𝗪𝗇. Our email is secretariat@𝗪𝗪𝗇.org. Then we'll be able to invite you. And when we give you the invite, it will come with the logins to an account. So there are 2 types of accounts you create. You create one account to be able to invite other people in your organization, the various departments, to carry out assessments in their own departments, because each department has their own data systems tool, so that they're able to combine all those data inputs into that last part that I showed, the data systems map. Then the question about using, the tool is ready for use. So anyone who is interested in using the tool can send us an email. Then we're able to share with them an invite. They're able to share the same invite with other members of the organization, etc. Then someone asked whether the assessment tool can be integrated with other tools. So this tool is not a tool for use for data collection or processing data as per se. This tool basically automates the data assessment maturity framework. So this tool is a tool to automate that framework that I have presented on. And the framework is supposed to help you assess or create an assessment of your data systems in terms of maturity levels, and you're able to see the gaps where they are, and you're able to create points of interventions. So this tool is not a tool for use on a day-to-day basis, or a tool that can be used to collect data on behalf of other tools. It's basically a tool to automate the assessment framework that helps organizations to carry out the assessment of their data systems. Thank you, Shuko.
Thank you, Joshua, for the response. Do we have anyone with a question who'd like to raise their hand and come off mute to speak? Okay, as we wait, I've seen a question from Annette Faye. There's a question on, I would like to ask which countries utilities have used the data maturity assessment tool that was presented. So you could take that question, Joshua, and then I've seen there's a hand from Michelle. Would take that after your response.
Thank you, Shuko. So when we were piloting the tool, there are several utilities in different countries across Africa. that have carried out assessments of their data systems using the tool. We have all the utilities in Zambia. They have gone through the assessment of their data systems, and we have available report of the results of the assessment. Then we also did pilot with the several regulators across Africa, mainly the member states of the ECOWAS. So we have assessments done for regulators in Kenya, Tanzania, Uganda, Zambia, Mozambique, and Angola. So the tool has been taken through a serious piloting, and we are confident that the tool is able to carry out the objectives and the scope that we have presented today. Thank you.
Thank you, Joshua. The microphones have been activated, so feel free to come off mute, raise your hand, and come off mute to ask a question. I see there's a hand from Michelle as we wait for other hands to come up. Michelle?
Thank you, Shuko. So I will address Cheyon's question directly, where he's talking about the conceptualization and visioning of a DPI, Digital Public Infrastructure Framework, for the drinking water sector. So just to quickly give people a recap on what some of the terms mean in here, there's a description of the availability of any standardized terminologies or controlled vocabularies, such as SNOMED-CT, which is used specifically for results of laboratory tests, LOINC, which is used specifically for laboratory tests, and for others such medical tests, as well as ICD-10, which is used for conditions, health conditions. I don't know of this specifically in the WASH ecosystem, but I have to acknowledge that these are some of the messaging standards that I brought up that were implied specifically with my description of HL7 as a legacy messaging standard and FHIR as a newer system that is supposed to be used in health applications across different platforms, allowing for the semantic interoperability. So, yes, we're aware about these standards. I wish I knew more about it from the WASH sector, but I'd be happy to talk more about it later on. Thank you.
And I would also add to direct you to the report that is on our website, specifically Chapter 4, where we discuss deriving WASH-relevant health indicators from health sector data systems. So we discuss things like ICD, like Michelle mentioned, so that particular chapter may be of use too.
Thank you, Abigail and Michelle. I see there's a hand from Ishaka. Ishaka?
Yes, thank you very much to all the presenters for this wonderful presentation. And my question, I just want to ask one more question. For me, I'm working with an informatic consultancy firm, it's a technological firm. Also partnering with the National Malaria Control Program, for which we work for most times in terms of digitalizing their tools and all of that. So I want to ask, how will these data maturity assessment tools help in the collaborating with the National Malaria Control Program and also my farm as well in helping the controlling malaria in my country? Because as of this phase, we are now in the elimination stage for the 2026 to 2030, which the NSP has been planned. So I want to know how can the data assessment tool help in the malaria.
Thank you, Ishaka. I know that your line was breaking a bit, but just to reiterate your question, you wanted to know how the maturity assessment framework could help with the malaria or intersect with the malaria data. And so, Joshua, the question is mainly around how the maturity assessment could help, in the collaboration with the health sector. And the example specifically pointed by Ishaka is the malaria response. Is there another question before Joshua and the panelists answer that question?
For my end, no, for now. That's my question.
Thank you, Ishaka. Anyone else? We could take 2 more questions and then we'd pass it over to the panelists. Okay, there's a hand from Paniso. Paniso, go for it.
Yes, thank you. Yeah, so my first question is to do with data use. So a lot of these tools, they are generating very interesting insights, but most of the decision makers, they don't get into this level of detail. Do you provide a summary of what is emerging from these tools or from the analysis of the data for people who are not like heavy data users? That's the first one. The second one related to it is, I wasn't much more interested in the health and water, the use of the health management information systems, because in the past I've had issues with institutions or government departments being reluctant to release the data, because once you release to some of these platforms, the data is gone and the governments feel like they have no control. I would like just to learn from you whether this is a challenge that is there and how you have resolved it. You said 2. Thank you. Yeah.
Thank you, Paniso, and thank you, Ishaka, for those questions. So the first question was around how the maturity assessment tool would help in collaboration with the health sector, specifically malaria programs. And then the next question was whether the platform provides summary reports for non-heavy data system users, like very high-level senior management folks who are the decision makers. And then the other question was around any experience specifically for health data and WASH, around data sharing for governments. So I would pause and pass it back to the panelists.
So I can address some of the health questions by Paniso and by Ishaka specifically. So first, I'm going to address Paniso's question about how data is difficult to release because governments may feel like that they lose control when it comes to data. So I have experience both with the US sector and with the international and global health sector. And I've seen differences in how this data can be addressed. In many cases, like in the United States, which is where I have the most experience with having data flow from like a lower level up to a higher level. In many cases, we do have cooperative agreements or data sharing agreements that we have to specifically specify what kind of data can be shared and what cannot be shared. In addition, it depends on the platform, but something that we did have specifically when I was working with CDC was specifically on platforms that could feed data in and give some feedback back to the lower levels if necessary. The data flow was technically one way, although the feedback always did go back, but it wasn't like a full data share. It wasn't like a full data copying, so governments didn't lose control of the data or agencies didn't do that. It was more of the data would flow up to like the national level, and you would have the data processing steps in place, like a data pipeline that was intrinsic to the platform that could actually take into account the data that was being brought in from the lower level to the higher level. What that meant with that, lower level still had control of the data that they did collect, but they did not lose. But the higher levels did have the ability to work with the data that they had so that they could then do additional steps to do standardization at higher levels, so that there was more collated decision making, even if the data at the lower level wasn't, standardized for all, for example, for all 50 states. As for Shaka's question about maturity intersection with malaria data and maturity assessment, I would have to let Joshua talk about the data maturity assessment. Malaria is a little bit of a interesting situation with how different platforms feed into each other, but I could definitely see a utility in this assessment being used. So I'll stop there and let Joshua go on. Thank you.
Thank you, Michelle. I will start at where you have stopped. Most of the time when you have all these programs, the key most important thing is establishing items like baseline data so that you're able to carry out the program. So most of the time, the people implementing the programs, the first thing that they do is to create a data collection tool or a system to be able to collect the data and manipulate the data until they get reports. So what we are saying is, instead of going in and starting to create new tools or you create new systems, you carry out an assessment of the tools that are already available so that you're able to see, do we have existing tools which have gaps? And if I fix the gaps both at the national level and maybe at local level for organizations which are already interacting with the program that you are trying to come up with, you're able to see, do they have existing tools that can be able to create exactly the same data sets that you need instead of adding more and more tools. So you use the tool to create an assessment. Then instead of bringing more technology, you fix the gaps that the tools have identified, and then you'll be able now to get proper data for your program to continue with your program. And now, after you leave your program, will have helped that organization or the national level to move data systems that can be used now in future to continue collecting enough data that can be able to progress the output of your program. In terms of summary reports that can be outputted from the data system, so that now non-technical people can be able to use the outputs of the system. The last part of the system is to actually generate a summarized report that have the gaps that have been identified, prioritized interventions, and the costs that are associated with the activities that you are supposed to carry out. So it's a more highly summarized report that you can now give to executives or you can give to a donor as you seek maybe for resources to implement those activities. We shall share a model template report in our website so that after you carry out your assessment, you get the technical aspects of the gaps that are there in your data systems. Then you're able to come up with a report that now you can be able to communicate the outputs of the tool to other non-technical people, maybe your executives and your donors or your financiers or even governments that are trying to help you improve your data systems.
Thank you. Thank you, Joshua. Thank you, Michelle. And I've seen there's one, we'll take one last question and then we would wrap up because we're at time. But just wanted to add to a few of the points that have been mentioned by our panelists, to say, one, the question around how the maturity assessment could support with the health sector. I think another layer is the fact that the assessment relies on already existing synergies, right? So for example, if you already have existing synergies between the water and sanitation sector and the health sector, then there's a very strong pathway that the maturity assessment is able to help assess linkages that are tied to KPIs and the linkages that the water and sanitation systems have with the malaria specific data or any other health sector data. And I say this because I think in Zambia, Lusaka has a very classic case where they have, even coordinated meetings between the municipality, the Ministry of Health, and the commercial utility as it pertains to data and basic coordination. And so there, the maturity assessment is able to thrive, right, and provide a lot more robust assessment as it could look at the ecosystem from that collaboration. But this is only possible because that is already existing. And so just wanted to add that layer to say, if the linkages already exist, then it provides a lot of opportunity for the assessment to even enhance the assessment. And then the other point that I wanted to add to is, data sharing, and where once data is shared, people feel it's lost. If you think about data systems and how they evolve, you have data systems usually start from a space where it's a lot of siloed, fragmented data, and a lot of people start crying for centralization of this data, just so that you have one central repository where everyone can have access to the data. But when you get to that centralized repository, you then have other challenges that are introduced, right? Because you have a central unit that controls data for everyone. So one, there's delayed access to the data, because there's a lot of people waiting to have access to this data. And then the second layer is that people are not usually willing to give their data because they feel they would lose the value that they bring to the ecosystem once they have shared that data. And now we're talking about data sovereignty within data systems. But there's this next layer, right, that data systems then evolve to, which is around democratizing access of data and data within the data system using the digital public infrastructure and DPI, which helps you maintain your sovereignty to data, but creates a pathway for different data systems to interact. So it's a lot of interoperability, a lot of data sharing agreements that Michelle had highlighted. But beyond that is also a lot of data standardization, and just to ensure that the data that flows through the infrastructure is of uniform standard, right? So that then creates an opportunity to ensure that there's cross-sector and cross-actor interoperability, and people don't feel like they're losing data, or that their data, they're losing value based on the data that they're sharing, but that their data is being leveraged for different purposes, and that they still own this data in the infrastructure. So just wanted to add those two layers, and I would pass the mic to Evans to ask the last question, and then we could get into wrap-ups. Evans?
Okay, thank you so much, Fuko. I think mine is just a comment towards Joshua's presentation, where he stated that 6.2 SDG is increasingly becoming difficult to report on due to lack of data, which is very true. But I think one experience I've had, for instance, in Zambia here, Lusaka, I just came to realize that in a system, for instance, that uses a delegated business model, where a third party is responsible for collecting information and then you load into the system. I observed that actually we have had more than enough data in the system, simply because it was part of the obligation for the service provider to provide information whilst we incentivize them. But as we came now to the full cost of payment, where incentives were withdrawn, I think you realize that a service provider starts becoming resistant to collecting data, and this becomes a bit challenging due to the fact that once you just withdraw that motivation or an incentive, it becomes extremely difficult for the third party to collect information that you may need, for instance, as a utility. Of course, you mentioned the one aspect I liked, continuous training. But then even that, it becomes a bit unsustainable to continuously train the service providers, because there are some certain situations where, for instance, a service provider has the trained personnel withdraw from the service. So you need to find some other personnel to cover up and, of course, continually train them. But in terms of, for instance, the bills to pay, it becomes a bit difficult and unsustainable for the utility. So it appears for me, I would have proposed that actually there should be a certain incentive so that we have as much information as possible to report towards SDG 6.2 because of the high resistance I'm seeing. What is coming out from the service providers who are responsible for collecting this data is that we are collecting information on your behalf, but we are not getting anything out of that. Not only that, we tend to be spending so much time in collecting information that belongs to you as a utility to report on. And in terms of maybe the profits or maximizing on the profits, it appears we are wasting so much of our time for them to collect that information on our behalf. Then with regards to data sharing, I agree with Shuko. I think we have had situations where you share information, you only come and read it in a certain section, and it becomes in fact that information, if it's shared, the recipients are not even acknowledging that this data was collected from this source. Yeah, so those are just the concerns I thought I needed to make comment on. Thank you.
Thank you, Evans, for the contribution. Any quick reactions from the panelists? Just quick. We had time. We need to close. But just quick reactions and then just your final text as we wrap up. Joshua?
I think Evans has clearly articulated what exactly is needed in terms of data. If you don't create value in data, particularly if you are a secondary user of the data, you have a problem with the primary data collectors. So what he needs to do is create value for the data that those utilities are using. Basically, if you have a national KPI, you can break it down into an organizational or a utility level KPI, such that part of the data that they are collecting is feeding into a KPI that they are using at the local level as an organization, which now later on feeds into a national KPI. If you don't create that value, nobody will collect the data for you. They will see it as an extra work for them, and they will not, even when they collect the data, it will not be of the quality that is required. Then in terms of data sharing, you need to establish, as I had said, a data governance framework that will now come with all those aspects of data sharing, data management, data security, and such. We have one more question that was asked about the data security on the platform. So once you get the invite and you create your own account, nobody else has access to that account. It's only you and maybe other people that you share the access to. So anything that you do on the data assessment maturity tool is secure, and it is only available to you until you decide to share the output or you decide to share access with other people. Thank you, Shuko, and thank you everyone for participating in this webinar. And I hope that we have created value in terms of improving data systems, and we are going to move forward into creating the assessments and seeing where the gaps are, so that we can be able to create priorities, and we can bring the resources to where they are required instead of adding more and more tools and systems in the water and sanitation sector, and also in the health sector that has been discussed also. Thank you.
Thank you, Joshua. Any last reactions, Michelle?
Yes, thank you, Shuko. So just to do a quick recap here, the practices that we've brought up for our recommendations and best practices are exactly that, best practices. We acknowledge that not all health sector tools are at the same level of maturity, but there are certain standards and frameworks that can be used to make the data more effective and interoperable. It was really interesting to hear about this from the WASH sector and to see how the data was being used within the data maturity assessment framework. And I look forward to any conversations that we may have in the future about this. Thank you.
Thanks, Michelle. Last reactions, Abigail?
Thanks. Yeah. Reiterating what Michelle said, but I think a lot of this comes down to building trust and making sure that we're not just we're going beyond identifying gaps and working together to address them. And I think a lot of those lessons can come from the health sector. So yeah, I think with these lessons learned, we can make a lot of progress in data system strengthening, and look forward to what everyone can do with this information.
Thank you to our panelists, and I know that now it's a matter of what are the next steps. We've had an exciting year from the WASH Data Labs front, and that's from the webinar end. We've spotlighted different tools, we have spotlighted different resources through the course of the year that all aim at ensuring that we have robust data systems that help us make the right decisions, the right investments to meet the needs of our ultimate end users, and ensuring that the data systems have a human face as well, not just looking at data as numbers, but relating that to reality, because that's the only way that we're able to make decisions that add value, either from a performance lens or from a service delivery perspective. We would be closing for the year in December, but we have one last webinar, which is an exciting webinar. So we have amazing speakers that would be joining us on that particular day. That's on the 4th of December. And this webinar comes at a time when right now there's a lot of shifts globally around investments, and investments not just in water and sanitation but generally everywhere, but the core focus will be on the water and sanitation space. With this investment gap, it calls for more data system strengthening and more data use, right? Because it means we need to show value for those investments, and the only way we do that is to ensure that we have the right evidence and data within our fingertips to drive evidence-based decision making. And we would try, on that particular day, and I'm super excited about the speakers, because the core would be to build an investment case for data, because we're also seeing this trend where there's a lot of focus around infrastructure and less around systems thinking and systems as a whole, when it should be the opposite, because those systems are what will ultimately inform the infrastructure and other investments, right? And so we would try to ensure that that webinar builds an investment case for data systems in a time like now, where we need to show more value using evidence. I would not preempt who the speakers are, because I want you to come and see the speakers for yourself, and I know that the team is going to put out communication around the speakers. But just to mention that you would have a voice from the core development space, a voice from a funding lens, and a voice from a data systems lens, but all grounded on the premise that we build an investment case for data systems and also empower everyone that has been attending the webinar as ambassadors and advocates for data system strengthening. Other things to look out for is you could continue to participate in the different activities that the WASH Data Labs has, ranging from interacting with the different outputs that we have on the website, from the tools dashboard, which is a repository of data and operation management systems used across Sub-Saharan Africa and South Asia, the non-WASH learnings, which is the health sector learnings that were shared today, the non-sewered sanitation landscape assessment report, just to get a sense of what is the current state of non-sewered sanitation and data systems across Sub-Saharan Africa, and then the non-sewered sanitation module TOR, which also includes system specifications that any utility municipality could adapt within their local context. But beyond that is also a pool of resources from the webinar series that includes videos and learning briefs. Feel free to also request presentations for any specific webinar that you may have missed, and then we hope to see you in the upcoming webinar on the 4th of December, and we would be sharing information with you in the next couple of weeks. Thank you all for joining. Super excited to have been your host today. Looking forward to the next webinar. Have a great rest of your morning, afternoon, and evening. Goodbye.